Everyone. Hope you're doing well. Sorry I didn't make a video talking to you guys yesterday. My back was just bothering me, so I figured I would just lay low. But I'm back today, and I'm hoping you're all doing well. The topic I wanted to talk about today was hypochondria. I am a recovering hypochondriac. I know that sounds really silly, but give me time to explain. When I was a kid, I was always fascinated with medical conditions. And looking back at it now, I realize it was part of my depression and my mental illness. But I was always very, what's the word I'm looking for? Susceptible to information I would hear. And you know that saying, idle hands are the devil's workshop? I think sometimes idle minds can be that too. I can remember my first instance where I thought something was wrong was I was about 13 years old, maybe 14, and I was on a family outing to the local science museum. And it was myself, my mom, my brother, my mother's friend, and my two best friends who were a set of twins. And we were going through the science museum. And we went into this room and it showed skulls of animals, skulls of humans. And I remember looking at the skull of the human and being very perplexed by it. And I remember feeling my head and realizing that I felt a lump, or so I thought. And I immediately panicked. And this is where I want to preface what it was I had a panic attack. It was my first panic attack. Well, anyway, I immediately asked one of my girlfriends, feel this lump on my head. Does that feel normal? Do you have that same lump on your head? So she felt hers and she didn't feel it. Then my other friend, she felt hers and she said, that feels just like mine. I was in a panic. I really quick, imagine in this giant science museum, I really quick went and found my mother and begged her to have us leave. And when she asked me why, I explained to her that I had to leave and go to the hospital because I believed I had a brain tumor, all from seeing a skull in a science museum. My mother thought I was crazy. She dismissed the whole situation. She told me to quit freaking out, and we weren't leaving. I was filled with dread. I could feel my heart racing. I was getting palpitations before I even knew what palpitations were. I was getting more and more panic-stricken. And the more I thought about it, the more convinced that I had a brain tumor. So we finally left, and I remember afterwards we went to a park. And it was behind this art gallery. And it was this beautiful park that I always enjoyed going to. But I could not relax because I was so panic-stricken because of what I perceived that I had was a brain tumor. So I was sitting there trying to relax, but I just had these feelings of dread come over me. And I told my mother, we need to go to the emergency room. I have a brain tumor. She asked me why. I told her, I saw the skulls at the science museum. I feel something on my head. It feels like a lump. I want to go to the emergency room. I would not calm down, so my mother finally relented and said, I will take you to the emergency room, but I am not staying because there is nothing wrong with you. You're just being ridiculous. This is too much. So she drove me to the emergency room. My two girlfriends stayed with me. I think my mother thought I was kind of faking it, that I wouldn't follow through and go ahead and get myself admitted to the emergency room, but I did. And I remember going into the emergency room and seeing the triage nurse and her asking me what my problem was and me telling her, I think I have a brain tumor. And I remember to this day, 30 odd years later, this woman looked at me and she said, "Well, honey, you don't look like you have a brain tumor." And I was enraged when she said that. And I said to her, "What do you mean I don't look like I have a brain tumor?" And she could tell I was really upset. So she tried to explain to me that usually there's signs like dark circles. There would be something she would see. I would be having headaches, something. She tried to reassure me and calm me down. And even though I checked no to all the questions that she asked me, I was still convinced that I had a brain tumor. So my mother came back. She came to the hospital. I remember going in the back and speaking with the doctors. And I remember this head doctor came down. Not a head doctor like checks your head, but an actual head doctor came into the emergency room, into my room, spoke with my mother and said, "Your daughter needs help. There is nothing physically wrong with her. You need to get her some mental help." I remember my mother being enraged. She couldn't believe that I would waste the doctor's time and waste her time and ruin a perfectly lovely day because I was convinced that I had this mystery ailment. The other doctors were kinder and reassuring to me and told my mother, they could run some more tests. And my mother said, "No, there's nothing wrong with her." This was before court-ordered psychiatry. My mother shortly after got me into some sort of therapy. Looking back, that was a panic attack. But part of my panic disorder, I was having hypochondria. You name the disease, I thought I had it. I was obsessed with MS because where I live, there's a high rate of MS in my area. I was always thinking I had MS. Cancer, you name the ailment, I thought I had it. At one point, I even thought I had a prostate problem, even when I was told that I do not have a prostate, that I am a female, and that I don't have a prostate. I was still convinced that I had a prostate problem. I'm telling you this story because it's amazing how your mind works. I was so deep into my mental illness at that time, undiagnosed, unmedicated, scared and afraid. The sky was the limit. To live my life every day in that kind of panic and that kind of fear, it was crippling, emotionally and physically. I couldn't focus in school. I was having a hard time getting along with my mother. I couldn't sleep at night. I couldn't focus on anything except this fear. This fear that something was out to get me. I didn't know what it was. I didn't know when it was coming, but it was surely coming. Luckily, I don't have that problem anymore. I got help. I reached out. I was talked to by a therapist. We got to the root cause of it. But I wanted to send this message out because I was speaking to a friend of mine who always thinks that she has ailments. And I know a lot of it has to do with her depression and her anxiety. When things get out of control in your life and you don't feel like you have control, sometimes our minds can go to places that they shouldn't go. And you need to reel them back. And it's funny because the people around her keep telling her, "Stop talking about it. Get over it." And it just harkened back to when I was going through it. How my mother would always tell me, "Stop it." How my friends would always tell me, "There's nothing wrong with you. Just stop. Get over it." It's not that simple. And I told my friend just today the same thing I said to the people that were telling me to get over it years ago. If you are sick of hearing me say it, think of how sick I am of feeling it. It's really difficult when you deal with a person who may have emotional or mental problems. Sometimes your patience can wear thin, and it's totally natural. It's frustrating when you want to help a person, and it seems like the more sense you try to make to them, the further away they get from you. I can't speak for all of us, but I will say this. I heard it. I heard it loud and clear. But getting myself to the point where I would believe what you were saying and fight my own demons and get past the fear and the anxiety and the depression and the trauma of not only what brought me to the depression, but the trauma of really thinking something's wrong when there isn't something wrong. That really is a stumbling block, and it takes time. So my advice to you is, if you're dealing with someone like that, please be patient. If you can, get them help. If they don't want help, recommend help. Do it kindly. Don't be cruel. Don't make jokes. There's nothing funny about it. We all want to be well. No one wants to struggle with inner turmoil. No one wants to go around feeling like the sky is falling or that they're dying. No one wants to feel like a victim. It takes time and it takes patience. And if you're someone out there that feels the way I used to feel, I understand. I encourage you to go and talk to someone. Get in touch with those feelings. Get to the root cause of why you feel the way you feel. There's got to be something. It doesn't mean there's nothing physically wrong. There could be. And then what? The best thing to do is to be proactive. Be proactive in everything that has to do with your life. Don't be ashamed. Those feelings you have are real. Whether there's something wrong or not, those fears you have, at least to you, are based in reality. So don't neglect yourself. If you feel like there's something going on, reach out. Talk to your doctor. A good doctor will take the time to listen, and if they feel as though you need to speak with someone about mental health issues, believe me, they'll recommend someone. And if they don't do it, take the initiative and find someone to talk to on your own. I know it can be scary. I know it's still very taboo, and it's ridiculous because there's nothing taboo about it. We all have our struggles. Be kind to yourself. Do what's best to make you feel better, make you feel whole, make you feel healed. Find your inner strength any way you can. If you have faith, pray. If you have loved ones close to you, ask them for help. And for the loved ones, I know it's difficult. Even though my mother had her times where she just wanted to put me in the corner and just tell me to get over it, sometimes she had to be dragged kicking and screaming. She stuck with it. She got me help. And I will be forever grateful for that. So that's what's on my mind today. Sorry if it's a heavy subject. It may not be everyone's cup of tea, but that's what's on my mind tonight. I hope this video finds you well. I hope someone out there can understand what I'm trying to get across. And until I talk to you guys again, you take care. Bye.